Now we'll try to actually move to the next artery in the body, and this is what is known as the inferior thyroid artery. Inferior thyroid artery. So for the inferior thyroid artery, you could see that this is the inferior thyroid artery, and this whole region, you could see that it looks like it's something that should be in the neck. Okay, so the inferior thyroid artery, you can see it red and circumference around it. So it's actually an artery in the neck. It also goes down to the word hand. Okay, so you could say it's an artery of the neck region anatomy, and also it's an artery of the upper limb anatomy. So that is actually what the largest branch of the thyrocervical trunk, which you see that the thyrocervical, this is the thyrocervical trunk. The thyrocervical trunk is on the subclavian artery. So you have it on the right side, you have it on the left side. You understand? So it ascends the neck, turns medially behind the carotid sheath, then supplies the posterior part of the thyroid gland. It also supplies the parathyroid gland. This is the thyroid gland. Okay, this gland is like a V. So at the back of the thyroid gland, of course, you have like 4 parathyroid glands. Okay, it's not shown because the image is just from the frontal view. So origin, we said that it arises from the thyrocervical trunk, which is a branch of the subclavian. So in 15% of cases, it also arises directly from subclavian artery. So that ascends along the scalenus anterior muscle at the level of the C6 transverse process. So it passes behind the carotid sheath. It also passes behind the sympathetic trunk and the medial cervical ganglion. So it reaches the lower border of the thyroid gland. Then it now divides into what? The different branches. So branches, we have terminal branches, so that the 2 main branches, we have the collateral branches. Then also the anastomosis, it forms with the superior thyroid artery. So it supplies the thyroid gland, supplies the parathyroid gland, and supplies the pharynx, the esophagus, the larynx, the cervical muscles. Beautiful. So clinical significance. When you are doing thyroidectomy, you have to be very careful about this artery. You don't want to cut it. For us that want to become surgeons, you have to know about arteries so much. So injuries can also cause some voice changes. If there's injuries to the inferior thyroid artery, it can affect how somebody's sounding. The person can sound like the voice will be how they used to call it. Yeah, the voice can be coarse, and the voice can be like a high-pitched voice. You understand? So then parathyroid surgeries too, you have to be careful. Then when you are doing imagings there, sometimes you can actually use this artery to see if there's any issues in the thyroid gland or the parathyroid gland or the surrounding environment. So that's what we got for the inferior thyroid artery.